Good afternoon. You're watching Beyond the Headlines. I'm DJ Moises. Two hospitals, two grieving families, different places, different stories, but the same unresolved questions. What went wrong? Who is accountable? And how do we ensure that this will never happen again? First, we talk about a mother who survived a life threatening medical emergency and is now grieving the loss of her child. Next, another family alleging inadequate equipment and a delayed referral, which they believe played a role in the patient's death. Now we move to our first story. Beyond the Headlines captured a social media post by a mother, Apol Amahan, preparing to give birth, faced a life-threatening emergency during labor. Her newborn daughter, Aimara Calyxa, tragically did not survive due to delays in referral and medical attention. The ordeal began at the Cebu City Medical Center where she was brought in, but after several hours of waiting, she was finally referred to Vicente Soto Memorial Medical Center for emergency intervention. The hours lost during this critical time made the situation even more dire, turning what should have been a moment of joy into a heart-breaking experience. So on the screen, makita na to ang iyang social media post, no? And moto ang gihatag nako nga summary. And for those of us or our viewers who are watching, feel free also to share your thoughts and even your questions about this matter because kanang in my opinion manggo, di ba, they would always say in the past na ang essentials in life are food, shelter, clothing, but personally I would already add technology, which is number 4, and I would also add healthcare, which is number 5, because I believe na kaning healthcare is no longer just an add-on, no? Because as we move through time, na-realize mangyid nato na food, shelter, or clothing will not really have much value, no, in terms of consumption and even generation in the absence of a healthy well-being, no? So that's why I hope that mga cases like this will further elevate the conversation how we can further improve healthcare not just in the city or the province but also in the country. So kaning particular case na gipost ni Apol Amahan sa iya ang social media account, nakoy mga pipila nga questions about this one. First, unsay explanation sa Cebu City Medical Center sa delay sa referral despite sa iya ang repeated requests, no? Kung tanaw nato ang social media post ni Apol Amahan, we will see that she's been requesting for that for the past 4 hours. But allegedly, she was not even answered or treated well. So, unsay explanation ani sa CCMC, no? Nganong grabe ang iya ang repeated request for a transfer but it was not granted immediately. And then na-realize sad nako nga ang Cebu City Medical Center is just very close to Vicente Soto, which eventually she was referred to. So you can imagine the time that was lost for a distance that was also very short. So in my opinion, an intervention would have been given immediately and it wouldn't have taken 4 hours, no, for CCMC to do that, in my view. Second said is, unsay protocol in place for urgent cases involving high-risk pregnancies or patients with pre-existing conditions. Because if we look at the social media post also of Apol Amahan, she was very clear, at least from how she narrated her story, that she has a thyroid condition. So that means it was already established early on, no? But the feedback going from her narrative that she's been given is isara daw ang ilaang doctor, no? So nakita naman unta, at least from this narrative, unsay cause, no, na siya pre-existing condition. They've also able to establish nga naaday shortage when it comes to doctors availability. But in spite of this being a high-risk pregnancy, and at the same time, her having a pre-existing condition, why was there no sense of urgency to immediately address it? And my final question, at least for this episode, is unsa day role sa mga hospital administrators in making sure that urgent cases such as this one is prioritized appropriately. No, I would have really wanted to also hear the side of Cebu City Medical Center, particularly the views also from the hospital administrator. So tomorrow we will be having an interview with Apol Amahan. And we also tried to reach Cebu City Medical Center, but to no avail. And we will continue to contact them. This story is deeply personal and painful. And so we would want also the views from representatives, if not the hospital administrator of Cebu City Medical Center, because that's always our stand in SunStar. We capture a story from social media that was posted by Apol Amahan, but we'd also want to hear the side of CCMC, because we believe that dialogue, transparency, and accountability are essential in healthcare. So now we move to our second story, and this time still involves urgency and also how critical it is to move a patient from one hospital to the next. A family is blaming rigid hospital protocols and a lack of equipment for a death of a 15-year-old boy following a road accident in Karkar City. According to the family, the teenager was injured in an accident in Barangay Valladolid early Friday morning and was rushed unconscious to the Cebu Provincial Hospital in Karkar. By around 4 a.m., doctors advised that he needed specialized tests and possible surgery, which the hospital could not provide. The family said they immediately requested a transfer to a higher level hospital, but the process was delayed due to the electronic referral system, which requires confirmation from the receiving hospital before a patient can be transferred. They claimed it took several hours before Vicente Soto Memorial Medical Center confirmed acceptance at around 10 a.m., with the patient arriving shortly before noon. The teenager, the patient, remained in critical condition and died 2 days later. Relatives also alleged that during the wait, medical attention was inadequate, forcing them to assist in basic care while hoping for faster intervention. Health officials, however, defended the e-referral system, saying it was designed to prevent hospitals from rejecting incoming patients and to avoid hospital hopping. The Cebu Provincial Health Office said an investigation is now underway to determine whether protocols were properly followed and if any lapses occurred. So, napog ko yung mga pipilang comments also about this particular case. Now, I understand that the purpose of the electronic referral system is to prevent na kanabitang ipadala na ang pasyente and then dili siya ma-accommodate. And that would result to a possible hopping from one hospital to the next, looking for a hospital that is available. And I get that. But my question actually is, why did it take several hours for them to be able to determine that? No, kung tanaw na to ang report that was also released from SunStar, the patient was brought at 1 a.m. No, the confirmation was already made 10 a.m. No, that's why eventually the patient arrived in Vicente Soto at 12 noon. So again, I see the value of the electronic referral system, but my question is, why did it take so long? No? Second is, what's the balance di ay, no? Okay, naman gid tayong mga procedures, naman gid tayong mga protocols. So again, I get the procedure no, of the e-referral system. But what's the balance between the need of having digital confirmation to the urgency of the medical care that's required by the patient? Because as at least reading from the article and reading from the post, we can see that it is a critical condition. In fact, after the patient arrived in Vicente Soto, 2 days later, the patient eventually passed away. So, it would tell us that dili ra ni siya mga normal na mga cases. So again, we understand the e-referral system, but how can we balance the digital procedure with the urgency of the emergency situation? No? So again, to be fair and balanced, we would welcome the Cebu Provincial Hospital in Karkar to join us and air their side of the story in the coming days, no? Because we'd also like to see how will the ongoing investigation, as they say, no, would conclude, no? Will that also trace the cause? Is it staffing level? Or is it availability of the equipment? What exactly was the need? What was available in the hospital? And how can this gap be addressed? And our purpose is not to point fingers or to put anybody on the spot. Just like our first story, our intention is to make sure that we understand the problem, we solution the gap, so that no family will ever have to experience this again. Because at least, I'm not a doctor, but looking at the narrative, I could say that these deaths would have been preventable if we only understood the importance of time and urgency. So these stories highlight the real impact of hospital protocols, delays, and gaps in cares on families in Cebu. But I think this is not even just a case of Cebu, but in many locations also in the country. Behind every story, behind every statistic is a human life. No? And behind the headlines are families who live with the consequences. Behind every tragedy are lessons we must learn. So from beyond the headlines, we will continue to follow these developments and keep you informed. I'm DJ Moises, and this is Beyond the Headlines.